Any fossa always contains these structures: artery, nerve, vein, lymph node, others. Hello, my dear friends. I'm Dr. Vaishali Bharambe, Professor Anatomy. What is popliteal fossa? This diamond-shaped space behind your knee is a popliteal fossa. So what are its boundaries? So it has a superomedial boundary, superolateral, inferomedial, inferolateral. So what are the muscles that are forming these boundaries? Superomedially, it is semitendinosus and semimembranosus. Superolaterally, it is bicep femoris. Inferomedially, it is medial head of gastrocnemius. Inferolaterally, it is lateral head of gastrocnemius and the plantaris. Let's go to the roof. It's covered by skin. Below that superficial fascia, there is a fascia called popliteal fascia. That popliteal fascia is pierced by two structures: short saphenous vein and posterior femoral cutaneous nerve. So we've covered the boundaries, the roof. Now what? Of course, the floor. What are the structures that would form the floor of popliteal fossa? The two bones, of course: femur, tibia. All these structures together form the floor of your popliteal fossa. So let's talk about the contents. But before we talk about the contents, I'm going to tell you a concept. Any fossa always contains 5 structures: arteries, veins, nerves, lymph nodes, and others. Which artery? Popliteal artery. Which vein? Popliteal vein. Which lymph nodes? Popliteal lymph nodes. Which nerves? Tibial nerve, common peroneal, posterior femoral cutaneous nerve, and genicular branch of posterior division of obturator nerve. And what is others? Others is basically fat. Now, through that opening passes your femoral artery, now called popliteal artery. Crossing that, on top of it is the popliteal vein. And then crossing that further superficially is the tibial and common peroneal nerve. So I'm going to talk about the nerves now. Sciatic nerve is the largest nerve of the body, dividing into common peroneal nerve and tibial nerve. So it gives rise to a number of branches. What are the branches? Muscular branches, cutaneous branches, articular branches, and vascular. So let's talk about the next nerve, the common peroneal nerve. This time again, ventral rami, but the root value is dorsal division. Here's your sciatic dividing into tibial and common peroneal. Now focus on the common peroneal. See how it's dividing into deep peroneal and superficial peroneal at the neck of fibula. Deep supplies the muscles of the extensor compartment of the leg. Superficial peroneal, which supplies muscles of the lateral compartment. So let's now talk about the popliteal artery. So popliteal artery is a downward continuation of femoral artery, which enters into the popliteal fossa through an opening in adductor magnus called as hiatus magnus. The popliteal artery gives rise to muscular branches, terminal branches, genicular. Students, if you're enjoying my lectures, do please like, share, and subscribe to my channel and hit that bell icon. I'll see you in my next video. Bye.